Welcome to the WRAL Daily Download. I'm Megan Glova. For months, WRAL has brought you troubling details and stories about Holly Hill Hospital in Raleigh. Now we're hearing from the CEO of that mental health hospital. Joining us now over the phone with those details is WRAL Enterprise Executive Producer Ashley Talley. Ashley, thanks so much for hopping on.
Thanks for having me, Megan.
Of course. So first, if you can just explain how this interview came about. Sarah Kruger, it wasn't just as simple as, I'll meet you here at this time, see you then.
I will have to tell you, it's been a strange day for interviews for our investigative team today. So just a little background on this story. We learned a couple of days ago that Holly Hill Hospital sent out a press release saying that they're now partnering directly with Raleigh Police to transport people who are in mental health crises directly to the hospital. As it stands, previously, they would have taken them to a local emergency room where they would be seen by a doctor or someone there who might refer them to a mental health facility. But they are kind of now going directly to the hospital. We had a lot of questions about this because we have done months and months of reporting on the issues that Holly Hill Hospital has had here, from 5 teens escaping from the facility in March to, we've talked to over 70 former patients, employees, and even executives there who have told us about really troubling allegations of everything from over-medication of patients to sexual assault allegations, understaffing, reporting from the company that, was not always on the up and up. So we were just really surprised to see that Raleigh was partnering with them. I reached out to Raleigh Police on Tuesday when we got this release and said, hey, we'd really like to talk to the chief about this, Chief Estella Patterson. We have some questions, and I listed some in the email, and we hoped to talk to her that day or the next day, but they made her available this morning, which was great. We felt like they were being really, coming forward and wanting to answer questions and wanting to engage in the process of how this came about.
Mm-hmm.
Well, this happened at the Martin Marietta Center this morning. We have an interview scheduled with the chief at 10 a.m. this morning. Sarah Kruger, our investigative reporter, and her photojournalist that was working with her today, Dwayne Myers, went there. And they were really surprised when they got there to find that the CEO of Holly Hill, Leigh Holson, was also there and was going to talk to us. And so that's kind of where the interesting stuff began.
Wow. And you did mention those 5 patients that escaped back in March. I feel like that's really the first time, the big major story I was made aware of Holly Hill Hospital. If we could start with that, what did Leigh Holson have to say about that incident specifically?
So, first of all, she said that that she was fairly new here, and that she was working on, she wanted to focus on things that happened since she had been there. Well, it turns out she got there just before these escapes happened, and so Sarah very pointedly asked her, well, what about you? And she said, well, there's always room for change, and we're looking at how we can improve things. But what happened before that is really sort of the odd part of the story here from a television reporter's perspective. So again, Leigh Holson, the CEO, was at this place where we were interviewing Chief Patterson. She basically agreed to an interview. We did the interview first with Chief Patterson, where we asked her how these things came about. She said that Holson had actually approached her a couple of months ago about creating this partnership. And Sarah asked respectful but challenging questions about, we reported on a lot of issues with this hospital. We asked Chief Patterson if she had seen our reporting, actually, and she said, no, I haven't seen it, but I do know about it. I've heard about it. And it went on from there. Sarah asked if there were to be issues, how would the police department respond to that? And Chief Patterson said, well, we would, we're always evaluating. We're going to try this out, but we do feel like we need to give this a chance to help people to get the fastest help they can. So at that point, the CEO basically said, no, I don't want to interview. She sort of waffled a little bit. And Sarah said, well, you're here, like, let's sit down and talk. And she goes, no, I think it'd be better if you emailed me questions. And Sarah said, you're right here. We have everything set up. We're a television station. We'd really love to just, talk to you about this, about the hospital. And, are you up for that? And after some back and forth, Holson agreed to let us record an audio interview and take a few still images of her and Sarah talking, but would not consent to having a video interview recorded of her. So what we ended up with is an audio version of Sarah asking her questions.
Okay, but still getting some more answers than we were even expecting, at the beginning of the day.
Certainly, yeah, certainly. We had no idea, obviously we were reaching out to Holly Hill, but had no idea that the CEO would actually be there and actually, be up for talking. One of the questions Sarah asked her is, why won't you sit down and talk with us on video? And she sort of went into kind of a long answer about how she needed to protect patients' privacy and all of that, though, to be honest, we're not going to ask about any patients. We weren't asking for specific information. We were really asking more about how the place was run and some of the issues that it had in the past. So when we finally did drill down to more specific questions to her, again, about the 5 teenagers who escaped after she took over, she said, quote, we developed really strong plans to make sure that any issues that could lead to a similar event in the future, that we have an action plan to make sure that won't happen again. We did get to talk to her, and I do applaud them for talking with us at all, because we have asked repeatedly in our past reporting for interviews that they've never agreed to. So to have the CEO actually show up at this event did feel like forward movement.
Sure. And did she happen to respond to any of those allegations of a little bit of a more serious nature, like lack of treatment or sexual abuse?
She did not. She
Okay.
did not. She really wouldn't, kind of go any further with what she would say while the audio of the interview was being recorded.
Gotcha. Well, very interesting stuff. When we come back, we'll hear more about Holly Hill's new collaboration with Raleigh Police. So we now know there's going to be a collaboration between Holly Hill Hospital and Raleigh Police. Ashley, how exactly did that come about, and what exactly will it entail?
Those were exactly some of the questions that we had when we went into this interview today. Sarah Kruger, WRAL's investigative reporter, had a list of questions that she wanted to get answers for our viewers for. And the first thing is, how did this come about? Like, as you just said, and it turns out that the CEO of Holly Hill, Leigh Holson, who we've been talking about, came to RPD police, to the chief, suggesting this partnership. They said it would be an effort to, divert patients who would have to go to emergency departments in local hospitals, instead allowing police officers to take patients in crisis directly to Holly Hill, which is, of course, a local inpatient behavioral health hospital. It should be said here that since Dorothea Dix closed its facilities years ago, there is no other inpatient hospital in the confines of Raleigh. The closest public one is in Butner, which is, maybe 30, 40 minutes away. Mm-hmm. So it was pitched, I think, as a solutions-based, project that would alleviate perhaps some of the emergency department backlogs that, we have been seeing happening too. We asked if there was any funding involved, right? Or is the RPD paying Holly Hill to help them, or is Holly Hill or its parent organization paying RPD to do this? And we were told that no, that there wasn't. We've asked about if there's a signed contract with details and everything, and that's a little unclear right now as well. But, those are things we're still asking. Another portion of this is that it took place at an event for ACORNS. ACORNS is an acronym for the new part of Raleigh Police that really deals with mental health crises. It's people who are trained in that field who can, help reduce stress when police have to respond to a person in a mental crisis. We did ask if an ACORN team member would have to be present when a person was transported there, and the answer is no. So, one question we had is this letting police officers who have many, training for many things, but not necessarily diagnosing mental health issues, is it letting them make these calls? And the way it was described to us is that an involuntary committal order could go through a hospital, but again, to alleviate some of the pressure on the hospitals, that assessment will now be done at Raleigh Hill itself. So it's, to an extent, cutting out the middleman, but Raleigh Hill Hospital is, a for-profit entity owned by Universal Health Services, and so those were some of the questions that we had going into it.
Okay, and is this already underway, or are there still some steps for this to officially be in place?
It's already underway. We don't know how many people have been directly transported there, but we do know that this partnership began, fairly recently, but began being talked about a few months ago, and it's already in place. So it's something we will continue to follow and ask questions about. And, we applaud the system, the Raleigh Police Department, and its partners for trying to put mental health first. We just have questions about the sort of troubled record that we have reported on extensively for the hospital itself.
Who will the enterprise team want to hear from most once this collaboration has been going on for a little while longer? Who will give us the greatest perspective that it's working?
It's a really good question. So today, Friday, we'll actually have a follow-up story today with more of the interview with Chief Patterson and CEO Holson, along with some past residents of Raleigh Hill that we have talked to who are really surprised at this partnership, as well as the parent of one of those escaped teens who is sort of really disturbed that RPD would enter into this partnership, knowing the issues that not only have happened there, but that RPD has actually had to deal with, right? Like, they are the responding agency when it comes to, they call them elopements when somebody escapes from the hospital. And, Raleigh Police are the ones who deal with it and help find these kids. So that will be part of our follow-up. We'll also be, following up on the money part of it. People going to Raleigh Hill, obviously, you have to pay for that service. Some may be on Medicaid, Medicare, private insurance. There are a lot of questions that we will continue to follow up on, and interested to see how this partnership works. We absolutely hope that it helps those in mental crisis in our community, and we will continue to follow up and see that if it's happening in the right way.
Okay, great. Looking forward to it. Ashley, thanks so much, and thank you for listening to the WRAL Daily Download. You can find this podcast on a variety of platforms, including WRAL.com, the WRAL News app, Apple Podcasts, Spotify, or anywhere you listen to podcasts. Follow the show so you don't miss an episode. Thanks for listening.